and visible. So welcome all of you in the next session of the USMLE based question, and I've got a very good reviews from the yesterday's sessions which we have taken on this same channel. Yesterday also in the evening we had the USMLE based MCQ discussion, so I request all my dear students to please be live for this session today as well. So I'm Dr. Chesta, your NEET PG educator on the best online platform. These are some of our learners who have cleared the on our app. This is very important. For this month of January, we have the Educator Curated Test Series scheduled for 13th, 17th, 22nd, 28th January. Then every Friday we have Study With Me YouTube series. On 9th of January, every alternate day we have NEET PG Grand Test, and 16th every alternate day we have FMG series. And the plus classes scheduled for this month is all of them. I request each and every one of you to kindly use my referral code CHESTA10 and get your subscription today. Now we have two types of subscriptions. One is Plus, which give you an access to Unacademy live classes from the top educators. You have Iconic subscription, which give you an access to both Unacademy and Prep Ladder. Prep Ladder give you added advantage of clinical integrated essentials, video lectures, question bank, rapid revision, snapshots, or treasure or dream notes. We have a lot of special classes which you can easily watch by downloading the Unacademy learning app. Go to my profile, that is Chesta Agarwal, and if required, put this code for watching these free live classes on the app. We have a very highly effective question bank of around 25,000 plus question. Again, you can get this by using the referral code CHESTA10. Now we have raise a hand feature, so if you have any doubt, just raise your hand and you can answer the question. Now the other batches for this month, we have a Focus FMG batch, which is a 4-month batch. Now here we will be targeting the 2022 FMG paper, and another exam is the Target NEET PG batch, which is an MCQ batch. So we will be discussing everything in a very rapid fire manner. I request each and every one of you to kindly be a part of this group, and this is a very important batch for all those who are preparing for NEET PG. You can use my code CHESTA10 and get your Unacademy subscription today. Now this is the price list. 3 months is best for NEET PG, 6 months for FMG, and 12 months or 18 months for next pattern examination. I request all of you to kindly use my code CHESTA10 and get your subscription today. Now let's start with today's session. Very important MCQ based session which we have today. Starting with the first question. A pregnant female complains of sudden onset of multiple generalized vesiculobullous lesion all over the body associated with pain, mild fever. On examination, we can see that the lesions have pustular tip. What is the correct answer of this question? What is the correct answer of this question? Anyone can tell me the answer here? Okay, now let us focus on the important points. One is that it is a pregnant female. In a pregnant female, if you see multiple lesions which has pustular tip, now it is also associated with pain, mild fever of the joint. Very classical of pustular psoriasis. And pustular psoriasis in pregnancy is also known as impetigo herpetiformis. Impetigo herpetiformis. Impetigo herpetiformis, the most common drug or the drug of choice is steroid. And please remember, this is the only indication of giving steroid in a patient of psoriasis. Other than that, oral steroids are absolutely contraindicated. And in fact, it is said that it even precipitates the development of psoriasis like erythrodermic or even pustular. But only in pregnancy, in impetigo herpetiformis, the treatment of choice becomes steroid. I hope this question is clear to all my dear students. Let's move to the next question on your computer screen. I think this image will be more clear if I shift it to here, this place. Yes. 63-year-old patient presented with lesions on his toe that has doubled in size in the past year. It is non-tender, does not bleed, but his wife says that it is getting bigger and darker on one side. Which of the following is the diagnosis? Which of the following is the diagnosis? Yes, Meena, you're right that the erythrodermic and pustular psoriasis mainly occurs because of steroid withdrawal. But in pregnant patient, even you can see without any steroid withdrawal, you can see presentations like pustular psoriasis. Clear? So a 63-year-old patient with lesions on his toe that has doubled in size in the past year. It is non-tender and does not bleed, but his wife says that it is getting bigger and darker on one side. The macule is 7 mm in diameter. Which of the following is the diagnosis? Malignant melanoma, melanocytic nevus, cafe au lait macule, or post-inflammatory hyperpigmentation? The correct answer of this question is malignant melanoma. Now I request all of you to just have a look on the image. Now if you look at this image, you can see that the lesion is very irregular in its size. It has dark color at one part, light area at another part, and the question itself says that it has suddenly progressed. It is getting bigger. So all these 3 points or 4 points are actually the ABCDE criteria, which indicates that the malignant melanoma have occurred in a benign melanocytic lesion. Okay, so this is a very important question. Let's move to the next question. A 35-year-old patient presented to the clinic because he has a worsening rash. He has a rash in the past on his elbow, knee, but after finishing a steroid pill for his asthma, he suddenly started worsening of the lesions. Anybody can tell me the answer? Meena, Dr. Priya, Deepak. Anybody can tell me the answer here? A 35-year-old patient comes to the clinic because he has a worsening. So can you tell me what can be the diagnosis here? Can you tell me what can be the diagnosis here in this patient? Very nice. This is a case of, again, acute generalized pustular psoriasis. Because he was taking steroid for some other condition, that is asthma in this case. And on withdrawal of the steroid, we suddenly see that there is development of acute generalized pustular psoriasis. Now, can anybody tell me what will be the drug of choice for this particular patient? He is a 35-year-old male. Can you tell me what can be the drug of choice for this particular question? Acute generalized pustular psoriasis, which of the following is the drug of choice? Meena, Tushar, GK, Dr. Priya, anybody can tell me the answer? Acute generalized pustular psoriasis. Acute generalized pustular psoriasis, the drug of choice, yes. So please remember, the drug of choice in this particular question is acitretin. Acitretin. It cannot be steroid because this is a male patient, so you have to give acitretin. Acitretin, which is oral retinoid. You cannot give this drug in a reproductive age female who is planning for pregnancy because it's a highly teratogenic drug and it remains in the system for up to 3 years because it is a fat soluble drug. So we usually avoid giving acitretin in a reproductive age female. But here it is a 35-year-old man with acute generalized pustular psoriasis. So acitretin becomes a drug of choice. The next question is on your computer screen. Dr. Priya, GK, Meena, Tushar, which of the following is the correct answer? Or what is the correct answer here? Anyone can tell me the answer? Now, a 47-year-old man with a history of recent subclinical hepatitis C infection presents complaining the rash which is present on the mouth. There is also a history of shiny, violaceous, sharply demarcated confluent papule with white lacy pattern. All these features are very classical of lichen planus. Now, what is the lichen planus? Lichen planus is an autoimmune condition which occurs because of autoimmune destruction of the stratum basale. Now, there are many predisposing factors which you see in development of lichen planus. Very important is hepatitis C infection, hepatitis C. The other very important causes are drugs which includes thiazide diuretics, and the third is for oral lichen planus we have dental mercury containing amalgams. Dental mercury containing amalgams, they are very important predisposing factor for development of lichen planus. Now in lichen planus you will see characteristic 5 P's. Can you tell me what are the 5 P's of lichen planus? Anyone? What are the characteristic 5 P's? You have a papule which is purple in color, papule purple polygonal in shape. It is highly pruritic or itchy, and it is plain topped. So we have pruritic, papule, purple, polygonal and plain topped. As well as in mucosa, what will you see? In mucosa, which is involved in 60 to 80% of the total patient, you will see presence of white lacy reticular pattern. White lacy reticular pattern, which is very common, and in few very rare instances you can even see the erosive type of lichen planus. So this is a very classical example of option number 1. Let's move to the next question. A 54-year-old woman with prominent scattered erythematous papule on the right side of her forehead. She has a burning pain in the areas for the past 2 days. Her pain is localized to the right supraorbital area and the right side of the dorsum of his hand. She denies headache, mental status changes. What is the most probable diagnosis in this patient? Shingles, lichen planus, tuberous sclerosis or photosensitive dermatosis. Which of the following is the correct answer? Which of the following is the correct answer? Very nice, absolutely right. So if I mark the important point, okay, I don't know why I'm not able to mark it, but the important point here is presence of burning pain on unilaterally on one side in a elderly female, and this is then followed by development of small vesicles. This is how a patient of herpes zoster classically presents. Remember that in herpes zoster you will see the lesions grouped in a single dermatome which will never cross the midline. Can anybody tell me which is the most common complication of herpes zoster? The most common complication of herpes zoster is post-herpetic neuralgia. Post-herpetic neuralgia is the most common cause of shingles or herpes zoster. So I hope this point is clear to all my dear students. This question, the answer is option number 1. Dr. Priya, GK, Meena, Tushar, absolutely right. The next question is on your computer screen. A child was recently put on a solid diet after being breastfed since birth. He now presents with perioral vesicular rash, sparing the upper lip, and there is diarrhea. Which of the following would be deficient in this patient? Which of the following would be deficient in this patient? Anyone? Which of the following would be deficient in this patient? Tushar, Dr. Priya, GK, anyone can tell me the answer? Very well done all of you, very nice. Anyone can tell me the answer here? Amazing. So a child recently put on a solid diet after being breastfed since birth. He is now presenting with perioral and vesicular plaques, sparing the upper lip and having diarrhea. This is a case of acrodermatitis enteropathica. Acrodermatitis enteropathica. Acrodermatitis enteropathica. Now what happens when you have acrodermatitis enteropathica? The patient will have the triad of DAD, that is diarrhea, you have alopecia, and you have dermatitis, which is very classical periorificial dermatitis. Very classical periorificial dermatitis. Let's move to the next question. A young boy presented to dermatology OPD with multiple shiny pinhead size lesions on the dorsum of the hand, forearm, penis. What would be the diagnosis in this particular patient? What will be the diagnosis in this particular patient? Anyone can tell me the answer? What can be the diagnosis in this particular patient? Lichen planus, lichen nitidus, lichen aureus, or lichen planus hypertrophicus, or lichen planus hypertrophicus. What is the correct answer? Very nice. This is a very classical example of lichen nitidus. The pinpoint lesions which are mainly present on the dorsum of the hand or on the penile shaft, very characteristic of lichen nitidus. And can you tell me what is the histopathological characteristic? What is the histopathological characteristic? Histopathological characteristic is claw clutching ball appearance. Claw clutching ball appearance. Here we have a claw clutching ball appearance, very classical of lichen nitidus. With this we are done with a very short session today. So I thanks to all of you for this patience listening. I request all of you to subscribe this YouTube channel, that is Let's Crack NEET PG. I also request you to please download the Telegram group of Unacademy for all its notification. You can use my code CHESTA10 to get 10% additional discount on the subscription. Please press the bell icon to get the notification. We also have a very classical series that is Study With Me. This 14th we have Study With Me with Dr. Priyanka Sachdev. I request all of you to kindly use my code CHESTA10. The top 1 rank will get 5,000 rupees cash prize, rank 2 will get 3,000 rupees Amazon voucher, and rank 3 will get 2,000 rupees Amazon voucher. I request each and every one of you to kindly use the code CHESTA10. Kindly use this code CHESTA10 and please enroll yourself in this pathology test which is scheduled for tomorrow. Please use this test. Thank you all of you and take care.